Well, thanks for staying with us. Next thing is for us to take a look at the World Hand Hygiene Day. Um, this is not unknown to many of us. What you would also find is that it's going to happen sometime in the course of the week. And then you want to make sure that you do the proper thing to wash your hands and all. So, World Hygiene Day, washing of hands and use of hand sanitizers is now what we all do, right?
It's a way of life now.
Yeah, it's become a habit for us now. Of course, that's no thanks to the pandemic. But many may not know that there is such a thing as the World Hand Hygiene Day. So if you didn't know, now you do. Every 5th of May in the year, we aim to maintain global promotion, visibility, as well as sustainability of hand hygiene in healthcare and to bring people together in support of hand hygiene improvement around the world. To have this conversation with us, we have Hannatu Bello, who is the Risk Communications Officer at NCDC, as well as WASH Officer of UNICEF in the person of Job Omini, but we'll keep going with that one. Hannatu Bello is with us at this point. Thank you so much for joining us this morning. Well, you may first of all want to bring us up to speed. It's not World Hygiene Day, it's World Hand Hygiene Day. Why that explicit difference?
And thank you for having me on the show this morning. World Hand Hygiene Day. We are talking about hygiene, but we are being particular about the hand. This is to show the importance of hygiene with regards to what hand is all about. You see, the Hand Hygiene Day is for you to talk about or get awareness created for people to understand the reasons or some of the reasons why they need to wash their hands regularly under running water and soap. The reason behind why people are encouraged to do this, to ensure that they stay healthy and prevent themselves from becoming infected with various diseases. The theme for this year's World Hand Hygiene Day is actually achieving hand hygiene at the point of care. Achieving hand hygiene at the point of care with the slogan, "Second saves life." Clean your hands. We all need to clean our hands. You need to clean your hands. I need to clean my hands. The reason being that when we keep our hands clean, we are likely going to be preventing ourselves from coming in contact with some of these infectious diseases. Thank you.
Well, madam, thank you very much for that one. But if you do not mind, could you kindly remove the mask? We can't quite hear you very, very clearly. Your voice is a little muffled. So if you could please do that for us, and then people might also want to be sure that they are speaking to the real Hannatu Bello of NCDC. So thank you so much. Now, you have given us a little bit of a background into this now. But another question a number of people might be asking is, clearly it is not something that came as a result of the pandemic, but no doubt the pandemic has made it even clearer. Are there specific industries or sectors that you think are crucial in this matter? We know health is definitely, the health sector is definitely that concern, but are there specific sectors? And from your experience as a risk communications person, what are the things we are battling with here if we do not pay attention?
Okay, so scientific findings have proven that hand hygiene is actually one of the most effective ways by which we can prevent infections. Do you know that we can actually prevent up to 50% of healthcare related infections? You know, healthcare delivery related infections. People need to know that when they do this properly, they will likely stay healthier, you know, for a longer time. When you talk about the sectors concerned here, of course, the health sector is the number one sector we are talking about here. We are talking about achieving that hand hygiene at the healthcare delivery. It will be number one, but then we need the water resources, anybody, any stakeholder that can come in through provision of water for the people to carry out these actions actually will also be very much important, will be very much needed. So we need to collaborate between the health sector, the water resources ministries, the providers of safe water for use in the communities, at the health facilities, at workplaces, for people to be able to do this, carry out these actions all the time.
Okay.
You know,
Anatu, I have a question for you regarding water, but we'll take that when we come back from this break. Welcome back, and thank you for staying with us. We're still looking at Hand Hygiene Day, and we're talking to the Risk Communications Officer over at the NCDC, Hannatu Bello. Now, you were talking about collaboration between the Ministries of Health and Water Resources. Now, I want to bring up the issue of water. Even with the pandemic and all the talk about wash your hands under running water, you and I know that maybe about 70% of Nigerians don't have access to running water. So how challenging is this campaign for you?
Well, it's been quite challenging, even getting people to understand the implications of not washing their hands, getting people to understand the reason, the benefits of hand washing. In as much as we do not have as much running water as we want, safe hand hygiene can still be practiced by people who are convinced that they understand the importance, or the importance of washing their hands, or the implications of not washing their hands. You know, it is very, very important for people to have the buy-in, the understanding that washing their hands keep them safe and healthy, and then people can devise ways of providing themselves with this water to wash their hands properly.
Well, madam, let me ask you about something you said earlier, and believe me, I was shocked. So please, maybe you want to expatiate a little further so that I don't go into fits. You said 50% of infections can be reduced simply by washing of hands. Please educate us on exactly how that works. How is an unhygienic hand, and how is it injurious or hazardous to the person who has the hands? Just tell us, maybe people may not, we do a lot of things subconsciously with our hands. We don't even know the implications of the things that we do. Could you take us through that? And how come 50%?
Okay, so practically, our hands are the ones we use to touch everything. We shake ourselves, we touch surfaces, we handle objects with the hands. They are the most used parts of our body for actions, for whatever we do. So it is easy for us to pick up infection from anywhere and everywhere at all time. This is why it is said that regular hand washings can actually protect you from becoming infected with diseases, while lack of hand washing can make you become infected with diseases more often. This is the reason why, like I was saying earlier, we all need to understand the implication of not washing our hands, and then the importance of why we need to wash our hands. If you have this understanding, if you are convinced that washing your hands can actually keep you safe from diseases, you will go to any length to ensure that you get water to use to wash those hands. I have actually seen a lady once in one of my response to the states, using a table water with a sachet of detergent that she went around in and used this to wash her hands when she had the opportunity to wash her hands. She was not waiting to have a tap standing by to do this. So for me, it is that understanding that you will actually be protecting yourself and others from becoming infected with diseases that should spur you to want to carry out this action. Remember, hand washing, it's not just protecting us from SARS-CoV-2, that is the COVID-19 pandemic. No, it will also protect us from other diseases, such as the Lassa fever. Are we talking about cholera? Is it meningitis? Every other communicable diseases, your proper hand washing under running water and soap will actually protect each and every one of us from becoming infected with these numerous diseases.
Now, Madam, how successful has this campaign been since it was launched? Again, taking cognizance of the fact that, especially in rural areas, I mean, you just spoke about somebody who used a sachet of pure water to wash her hands. How many people in the rural setting can afford to wash their hands with pure water?
Well, I actually didn't say pure water. I said bottled water. And the bottled
okay.
water, I mean,
Even,
is
even worse,
refilled.
even worse.
I am not thinking she bought a bottled water to wash hands. It's refilled water. What I'm trying to pass on here is the fact that she knew she needed water to wash her hands. So she provided herself with this water to carry around and wash her hands with. You see, the WHO multimodal strategy for improved hand hygiene has actually been very, very effective, because this has led to reduction in health care acquired infections. You know, it has made us to be able to see that following through, implementing these hand hygiene policies and making an investing in hand hygiene policies can actually go a long way with ensuring that people stay healthy and protected from infectious diseases. Of course, what it means also is that we need to do more. Whatever we are doing presently, the governments, the individuals, organizations, everybody needs to, we need all hands on deck. Everybody needs to come on board to do much more to achieving these clean hands we are talking about. It is not one person's business per se. One individual cannot do it. An organization cannot be solely responsible for the actions of every other person. So even as individuals, we have our own responsibilities to carry out, while government has its own to carry out. So this is the point whereby government needs to make more investment into providing basic water services at healthcare facilities, at workplaces for the use of the people.
Madam, my question was, how successful has the campaign been? Are you making progress? Are people buying into the campaign and washing their hands more, even in places where they don't have running water?
Yeah, before COVID-19, it was, I wouldn't say we made much progress. But of course, yes, with the pandemic, we have been able to get more people to buy into the idea of washing their hands. People are buying the idea, they're becoming more interested in washing their hands, and they are beginning to understand also that it is important for them to do so. Of course, I will say we are getting somewhere, but we need to do more. There are people who still feel that they do not have to follow the appropriate hand washing technique to get their hands washed. You find people washing their hands, for instance, within 2 seconds without soap, and they will tell you they have already washed their hands. So what we do is show people how to wash their hands properly, appropriately, using running water and soap. When we say running water here, it does not necessarily have to be a tap water. It can be water you are pouring out of a cup, a kettle, a jug, any container that you can pour water out of can actually serve as running water. We have the Veronica buckets. We have so many other things that people can actually use to get the water to wash their hands. So yes, we are getting somewhere. It's actually becoming more popular amongst people now to understand that if they wash their hands with soap and water regularly, they will likely stay away from becoming.
You mentioned earlier that the theme is achieving hand hygiene at the point of care. Can you please explain that to us?
So the point of care here is the health facilities. As simple as it seems, appropriate hand washing, people still don't do this as often as they ought to in order to get their hands clean. So the NCDC has been training and retraining, trying to build the capacity of health workers at the facility, at the healthcare facilities, you know, on IPC, that is the infection prevention. So at the health facilities, to ensure that they wash their hands at the appropriate time in the hospital settings, at the healthcare facilities, so that they can reduce the rate at which healthcare workers become infected, even patients and patient relations. So this is what has been going on.
Well, it's hand hygiene that we're talking about here. And in the medical experience, what we have been taught by those of you in the sector is if you don't use running water with soap, you could use a hand sanitizer, you wear a glove that you will have to remove from time to time. How do these interventions work together, or what do you have to say about these different interventions? Does one serve in place of the other, or do you think they all go hand in hand? What do you have to say about that?
Okay, so wearing of gloves is actually not encouraged, because when people put on the gloves, they will likely move around with the gloves, touch infectious surfaces, and infect other infectious surfaces because of that false idea that they are protecting themselves with the use of the gloves. So we do not encourage people to put on gloves and move around with the gloves. Rather, like you said, washing our hands under running water is very much more preferred with soap, under running water and soap. But in the absence of running water and soap, a hand sanitizer will suffice. But then we will still tell you that when you get to where you have water and soap, please do wash your hands under running water and soap. But then, of course, there are also there's a technique for proper hand washing. You know, we usually tell people that washing your hands for 2 seconds or 5 seconds under whatever, whether it's running water or not, and telling yourself that you've cleaned your hands is not enough. So we like people to just follow the proper hand washing technique. For instance, wetting your hands, putting the soap on your palm and rubbing your hands together like that, and then you wash the back of your palm to the back of your hand to one palm, doing the same with the other, and then interlacing your fingers and your palms together like that, and then washing the back of your fingers by ensuring that you roll them like this, and doing the same to the other hand before going towards you washing your thumb from base to tip like that, you know, to ensure that you move out all the dirt, and then you wash the tip of your fingers by rubbing it in a circular motion onto the palm of your hand, and doing the same for the other one before you eventually wash the hands up to the wrists, and you rinse dry with disposable towel or tissue paper, or you air dry as in whatever situation you find yourself. So by the time you do this, you would have taken like 30 to 40 seconds to clean your hands. And believe me, if we can only try to imbibe this, make it our habit, let it become part of us, then we encourage other people to do the same. By the end of the day, we would all collectively be doing what is right, and then keeping ourselves and others protected from infectious diseases.
Whether
And then
you
I
like
think,
it or not.
of course,
Yeah.
these measures work well if we do them appropriately. If you don't have the other, use the other. But if you have the two and you feel that you want to use the two, for instance, you may have gone into the washroom and you wash your hands, but unfortunately you touched the knob, which you are not supposed to do as you walk out of the washroom. You can quickly use hand sanitizer and sanitize your hand again.
Oh dear, madam. I don't even know where to begin with this. On the one hand, you have taught us how to wash our hands. I mean, I don't imagine anyone will want to wash his hands. And no one has ever done this. I haven't seen anyone do it until now. Thank you very much for that one. But let me ask you, in the course of doing your work as a risk communication officer, what are the challenges you have faced? What kind of pushback have you gotten from people?
A lot. There are a lot of challenges. Usually it is denial, and then there's this lack of information or lack of awareness on the part of the public. Most of the time, people look at the same scene from a different angle that we are looking at the scene from. So we try to get them to be on the same page with us. We try to get them on the same page with us and explain the situation to them. And by the end of the day, sometimes we get them to start thinking the way we think, and they start doing what we do. In fact, I have come in contact with one permanent secretary in one of the states of Nigeria when we went for a Lassa fever intervention. And I taught them how to wash their hands properly, because we had a meeting. We engaged the management staff of that ministry together with the PAMSEC. And by the time we finished, the PAMSEC was like, "Madam, please, you need to do this again. I want us to videotape the method so that we can practice." Believe me, some months later, when I went again for another intervention, and we happened to go to the same ministry, we were asked to wait for him in his office. And when he came, we saw him trying to air dry his hand. And he said, "I was washing my hand the way you taught us." So we were quite pleased. And he said, "We have ensured that our staff wash their hands all the time." This was even before COVID-19. This was before the intervention, the pandemic of COVID-19. So, but initially, he was not that keen on what we had to do when we went. Eventually, we got a buy-in, and he started washing his hands regularly and even encouraging his staff to do same. So whenever we meet up with challenges, at the community level, we try to sit down, engage the people, talk about the situation, and then get them to understand what they need to do right to ensure that they stay healthy from diseases. Thank
Now,
you.
just very, very quickly, madam, how frequently in a day should one wash hands?
For me, I would say as often as possible. But there are those hand washing moments that we encourage people to practice. For example, after the use of the toilet, yes, before eating and after eating, before you go into the kitchen to cook, during cooking, after cooking. Whenever one is caring for a sick patient, we also encourage that person to quickly wash their hands after caring for a sick person. And then, of course, before tending to injuries. If somebody has an injury and you need to tend to such injuries, please, you need to wash your hand quickly. And then at the healthcare settings, the healthcare providers have also been taught to wash their hands at different strategic points. You know, they have the 5 movements of hand washing, which include before you care for a patient, after carrying out a procedure. The healthcare providers know all of this. So by the time they do theirs at that level, and others in the community also carry out their own part, the world will be a better place for all of
For
us.
everyone. Well, we have to thank you very much, madam. At least now we can eliminate the part of before and after shaking hands, because we don't shake hands anymore officially. We have to thank you very much for being a part of this conversation this morning. Hannatu Bello is NCDC Risk Communications Officer. Thank you so much for your time and thoughts. Yeah, so we're back after now for another conversation.